We are aware of very disturbing reports about an Israeli attack on the grounds of a hospital complex in central Gaza. The Secretary General condemns the large number of civilian casualties in the intensifying Israeli campaign in northern Gaza, including its schools displacing sheltered Palestinian civilians. He strongly urges the parties to the conflict, all parties to the conflict, to comply with international humanitarian law and emphasizes that civilians must be respected and protected at all times. Humanitarian assistance into Gaza is woefully inadequate and is at the lowest level in months. The Secretary General underscores that the parties must ensure the safe and secure delivery of humanitarian assistance to those in need at the level at which they need it. There must be safe environment as well for the second phase of the polio vaccination campaign, which is to be completed, and I'll have a bit more details on polio in a moment. Today, a team from the Office of the Coordination of Humanitarian Affairs, alongside with colleagues from the World Health Organization and the UN Mine Action Service and the UN Human Rights Office, visited the Al-Aqsa Hospital in Gaza to assess people's needs following last night's attack. The Al-Aqsa Hospital was also meant to be used as one of the polio vaccination sites. Out of the hundreds of displaced families sheltering in the courtyard, some 40 families were affected, half of whom lost their children and other belongings in the fire. Aid organizations are mobilizing the humanitarian response. Among the assistance most urgently needed are tents and tarpaulins, beddings, hygiene kits, clothing, children's supplies, kitchen kits, as well as food. The assessment noted that patients at Al-Aqsa Hospital were referred to nearby medical facilities due to influx of trauma injuries following a strike on UNRWA's school in Nuseirat. Despite all of this, the second round of the polio vaccination campaign began in the middle area of the Gaza Strip today. Over the coming 12 days, colleagues at UNRWA, the World Health Organization, UNICEF, and others aim to vaccinate around 590,000 children under 10 years of age with a second dose of the oral polio vaccination type 2. This follows the first round, as you will recall, which was successfully implemented from the 1st to the 12th of September, which reached more than 559,000 children, or an estimated 95% of the eligible children at governorate level. That's according to independently conducted post-campaign monitoring. As with the first round, the second round will have three phases, each involving 3 campaign days and one catch-up day. The polio vaccination campaign began. UNRWA renews its urgent request to all parties in this conflict to implement the necessary humanitarian pauses in Gaza for the second round of vaccination campaign to be successful. Meanwhile, the World Food Program today warned that escalating violence in northern Gaza is having a disastrous impact on food security for thousands of Palestinian families. WFP says the main crossings into the north have now been closed with no food aid entering since October 1st. Food distribution points as well as kitchen and bakeries in northern Gaza have been forced to shut down due to airstrikes, military ground operations, and evacuation orders. Last of the World Food Program's supplies in the north, that includes canned food, wheat flour, high-energy biscuits, and nutrition supplements have been distributed to shelters, health facilities, and kitchens in Gaza cities and 3 shelters in northern Gaza. If the conflict continues to escalate at the current scale, it is unclear how long these limited food supplies will last, and the consequences for fleeing families will obviously be dire. Turning north to the situation in Lebanon, I can tell you that the Secretary General has been in very frequent contact with the force commander of UNIFIL, the UN peacekeeping mission, and that's General Alrodo Lazzaro. The Secretary General is extremely appreciative of the courage and dedication of the more than 10,000 uniformed and civilian peacekeepers serving in the mission. Our UNIFIL colleagues continue to monitor the situation. On Sunday, the mission detected 1,557 instances of firing across the Blue Line. That's the highest number in one day since October 8th, 2023. 1,441 of these originated from south of the Blue Line, primarily striking areas in Sector East of the UNIFIL area of operations. There were 116 instances of firing from north of the Blue Line into Israel, with Hezbollah drones striking near Haifa, reportedly killing 4 IDF soldiers and injuring several others. Over 30 people have been killed in southern Lebanon since October 10th. UNIFIL continuously assesses and reviews all factors to determine its own posture and its own presence at its positions across the Blue Line. The mission is taking all possible measures to ensure the protection of its peacekeepers. UNIFIL's roles and its presence in southern Lebanon, as you know very well, is mandated by the UN Security Council. In this context, UNIFIL is committed to preserving its capacity to support diplomatic solution based on Security Council Resolution 1701, which, as far as we are concerned, is the only way forward. You saw over the weekend a series of events happening along the Blue Line in which our peacekeeping mission positions were impacted and some of the peacekeepers were hurt. UNIFIL colleagues had said that since October 1st, UNIFIL positions have been impacted on 20 occasions, including by direct fire, and on one occasion breached by 2 tanks from the IDF. To address these issues, among others, the head of our peacekeeping department, Jean-Pierre Lacroix, will be briefing the Security Council later this afternoon in closed consultations, and he's expected to underscore concern with respect to the continuing exchange of fire across the Blue Line, as well as the repeated impacts on UNIFIL positions in recent days. 5 peacekeepers have been injured during these recent incidents, including 1 peacekeeper who sustained a bullet wound. The peacekeepers have been treated and are in stable condition. The source of that gunfire has yet to be confirmed by UNIFIL. You will have seen various statements issued by UNIFIL this weekend, and also a statement issued on Sunday on behalf of the Secretary General, in which he reiterated that UNIFIL's personnel and its premises must never be targeted. Attacks against peacekeepers are in breach of international law, including international humanitarian law, and they may constitute war crime. He called on all parties, including the IDF, to refrain from any and all actions that put our peacekeepers at risk. On the humanitarian front, we and our partners continue to support the response in Lebanon, despite increasing challenges, including insecurity and displacement orders, which have forced some of our partners to reduce operations in south of the country. Humanitarian organizations continue to deliver food, water, and medicine, along with mattress, blankets, sleeping mats, and other essential supplies to those in need. Health partners are also active in shelters and delivering primary health care consultations. This comes as more than 1 million people have already been displaced, both within Lebanon and to other countries, with that number expected to rise as hostilities continue. The situation is worsening, and our humanitarian colleagues from the Office of the Coordination of Humanitarian Affairs tell us that Lebanon is now in the midst of its most devastating humanitarian crisis in a generation, with civilians continuing to bear the brunt of the ongoing violence, with more than 2,200 deaths and over 10,000 people injured so far reported by Lebanese authorities to us. Health facilities were also heavily impacted. WHO reports that out of 207 primary health care centers in the conflict area in Lebanon, 100 have now been shut down, severely limiting access to much needed health care in this time. 5 hospitals have also been closed due to structural damage from ongoing attacks, further straining an already overstretched healthcare system. The violence has resulted in the deaths of 94 healthcare workers while on duty and the destruction, as mentioned, of vital facilities. To add to the current challenges, WHO and its partners are warning now that the rapid displacement and shortage of clean water in the country over the recent weeks is increasing the risk of spread of infectious disease in overcrowded shelters, especially ahead of winter. Many displaced people also lack medication and other needed supplies. We repeat once again that parties to the conflict must take all feasible precautions to avoid and minimize harms to civilians and to civilian objects, both in attacks and against the effect of attacks. Turning to Yemen, you will have seen over the weekend a joint statement in which we issued which was issued by a number of heads of UN entities and non-governmental organizations concerning the arbitrarily detained personnel in Yemen. In the statement, they expressed their extreme concern about the reported referral to what's called a, quote, criminal prosecution by the Houthi de facto authorities of a significant number of our arbitrarily detained personnel. That includes 2 of our colleagues from UNESCO and 1 from the UN Human Rights Office. And they've been detained, those were detained in 2021 and last year. The heads of UN agencies underscored that the potential laying of, quote, charges against our colleagues is unacceptable and further compounds the lengthy incommunicado detention they have already endured for way too long. In addition, such a decision raises further serious concerns about the safety and security of our staff and their families, and will further impede our ability to reach millions of Yemenis who so desperately need humanitarian aid as well as protection. And just as a reminder that we and our partners are working through all possible channels with multiple governments to secure the immediate release of all those detained. And as we speak now, UNHCR is delivering its Nansen Refugee Award. That's going on in Geneva. This year, the global laureate is Sister Rosita Milesi, a Brazilian nun and social activist. In a post on Twitter, the Secretary General congratulated Sister Rosita for receiving the award. For over 40 years, he said she has been shown to be an unwavering support of refugees and migrants, and in a world that can so often seem bleak, she's a beacon of hope for all those who are forced to flee. 4 other trailblazing women are also being honored this year for their regional work with refugees and displaced women and children. They're Maimouna Ba, who is a grassroots activist from Burkina Faso, Jin Davod, a young social entrepreneur who's helped Syrian refugees, Deepti Gurung, a Nepali activist who campaigned to reform her country's citizenship laws, and finally Nada Fadol, a Sudanese refugee who's been mobilized essential aid for for hundreds of families fleeing to Egypt in search of safety. The UNHCR Nansen Award honors individuals, groups, and organizations who go above and beyond the call of duty to protect refugees and stateless people. We congratulate them all.